In a city like Bombay, we have realized the shortage of hospitals and health facilities. What I foresee is that the building typology in architecture is going to change completely. A school or an office building is now going to be designed at the onset in a manner that it can be transformed into a hospital when a pandemic or a situation like this arises.
In these days of COVID, we've actually designed a DMHU. And what is a DMHU? DMHU is basically a disaster management healthcare unit. This is basically designed in such a fashion that it takes care of any sort of disaster that can hit the country. It could be like we have COVID, we could have floods, we could have earthquakes, we could have any sort of pandemic or any sort of epidemic that can hit the country. It has been so designed that it can accommodate around 64 to up to 200 patients or people who are suffering from pain. It can even be used as a labor camp also at the same time. Now, it's designed in such a fashion that it's basically designed out of a shipping container, and we've designed it into it's like a module which can be repeated, and it is very easy to execute. It is very economical at the same time, and this really helps to bring about something which, like for example, if you have to design a basic 64-bed hospital, it could be done in a matter of maybe 2 to 3 weeks. That is what is actually required, and the main advantage of that is that it is not. It's like a thing specially designed for a disaster management, which can happen anytime or any sort of crisis which can hit the country. So we don't have to depend on using up public spaces or like a stadium, or we don't need to use up exhibition ground. We don't need to use up hotels or existing apartments, and so you're not actually sort of saturating that in any sense. At the same time, you're not even we are already short of a lot of beds in the current healthcare situation of our country. So even in that sense also, it helps to relieve that strongly.